News edits continue shortly. Please stay tuned. In Nigeria's health sector, tensions have eased, at least for now. Resident doctors have dropped their planned nationwide strike after the federal government made fresh concessions. These include reinstating allowances, promises to clear long-standing salary arrears, and approval for funding of medical residency training. But the doctors say it's not yet to huru, as they will reconvene in May to review whether the government delivers on its commitments, warning that strike could resume if promises are not kept. To help us unpack the concessions, the conditions attached, and what this means for the health care delivery system, I'm joined here by Dr. Douglas Okor. Dr. Okor is a health sector reforms advocate and also a consultant neurosurgeon. Welcome to the program.
Thank you, Eddie, for having me, and also thank you, ADBN TV, for having me as well.
Doctor, let's start on a personal note. As a neurosurgeon, how do you find the practice in Nigeria?
Okay, so first of all, let me state that I actually did my medical school here in Nigeria before I moved to the United Kingdom and actually trained to become a brain surgeon in the United Kingdom, and I've been back in Nigeria now for almost 10 years plus, okay? So when we talk about what a proper healthcare system should be, I know what it is because I've been in Nigeria and I've been in the UK as well. Clearly, the Nigerian healthcare system, I can describe it as being broken and extremely weak, okay? We are struggling within the Nigerian healthcare space. And clearly, initially, when I came back from the UK, I was in the private sector, but I now also struggle with the public sector as well. So I actually deliver care to the poorest of the poorest people in Nigeria. And I can say that we have a broken and weak healthcare system, and lots of work needs to be done on our healthcare system, Eddie.
So what would you attribute the lapses to?
So I guess generally a people, a community, a country, they prioritize things based on philosophy and culture in terms of what they actually determine that is important, okay? There's what they call the value for human life, Eddie, okay? So the value for human life in places like Canada, Australia, Germany, UK, USA is very, very high. Okay, I'm sure you saw when they lost a pilot, the United States lost one of their pilots, one of their military men in Iran. The way they deployed everything to make sure that they actually got that one person. Okay, so that's a philosophy. That means every man is important. The value for every life is important. Now, if you look at Nigeria and look at most of the places in West Africa, Africa, Sub-Saharan Africa, the value for human life is very, very low. Okay, so when you talk about development in a country, the healthcare, in fact, there are three pillars, okay? The healthcare, education, and relevant infrastructure. I put that very specifically, okay? But for some reason, in our part of the world, because our value for human life is extremely low, we have not prioritized from a philosophy and a culture point of view those things that are important that really impact on human lives, and healthcare is one of them. And let me just remind you, Eddie, if you look at what we call the Sustainable Development Goals, the SDGs, which was brought by the United Nations. There are 17 of them. 1, 2, 3 to 17. Guess what healthcare is? Healthcare is number 3, and education is number 4. They are that important. After looking at poverty and hunger, the 13 is actually healthcare, and the 14 is actually education. So clearly, you understand, at all levels in our country, in Nigeria, we have not prioritized and mainstream healthcare, and so that's why we're actually struggling.
Wow. It's becoming a regular feature in the country, resident doctors going on strike. Yet, we don't seem to have experienced commensurate improvements in healthcare delivery. Why? So
the thing is that resident doctors going on strike is just a representation of the fact that other healthcare providers actually go on strike. So let me just state this here, Eddie, okay? Healthcare in a country, healthcare is a very complex system, okay? And it's a very important system in the development of any nation. Healthcare is not about doctors, okay? So you can use the resident doctors as a representation of the healthcare workers in Nigeria and actually ask the question, are healthcare workers in Nigeria having a good deal? Healthcare workers having a good deal and plus creating an environment
but where the doctors themselves, they say part of the reasons they go on strike is for the benefits of the entire system. not entirely for their selfish aims, to attain their selfish aims.
Well, so yeah, there is a strong point there. But what I'm saying is that it is not only resident doctors that have gone on strike. Okay, in the recent past, you had the joint health sector unions, which is every other healthcare professional apart from nurses, doctors, and dentists. Okay, so what I'm saying is that there's nothing new. As well, when you say, oh, the resident doctors have gone on strike, oh, they've called off their strike, oh, they are pushing to actually have this for in terms of their welfare and stuff like that. Every healthcare professional in Nigeria is not taken care of. Okay, so that representation in terms of using the resident doctors as a catchment to say, oh, it's reflective of all other healthcare providers as well. Again, back to what I said earlier, Eddie. When you don't prioritize something as important as healthcare and stuff like that, in your deeds, in your financing, in your body language, in the way you actually spend money, in terms of how you prioritize as a government, as a community, as a state and stuff like that, you will see that reflecting in, like we've talked about, talking about the resident doctors now, in terms of their welfare and how you're looking after them and how, what importance you actually attach to resident doctors and of course, by extension, other healthcare professionals as well.
So, as an advocate in the system, what key reforms do you think should be introduced to better the system?
I think, first of all, the first thing is the reform in philosophy and culture, first of all. It must start from there. Okay?
Philosophy
and culture.
Yeah. Could you expatiate?
Yes. Thank God that culture is, how will I put it? Culture can change.
Dynamic.
It's dynamic, exactly. Thank you. Culture is dynamic. So the first thing is to actually change that culture. One of the things I always say is that think right, act right, and spend right. So your thinking is of philosophy. Okay? Eddie, you only spend your money on things that you think is important. So as an individual, as a group, as a community, as a state, as a country, you will only spend your resources on something that say, oh, I think this is important. So the first thing is for all of us across horizontally and vertically, all the way from governments at national level, subnational level, the legislature at national level. So all of us, the community, the people, first of all, we all have to repent and actually understand the importance of healthcare first. That's the first thing. Okay. Second thing is when you talk about we call them leverage areas, high leverage areas, okay, where we need to actually put our muscle. In 2001, there was the Abuja Declaration. Guess what? It was actually in Abuja here, where the African governments pulled together and said, oh, we should push to actually have 15% of our budget going to healthcare. Okay, so the first thing is that we need to do something about the financing and funding of healthcare. It's extremely important. Financing and funding. Absolutely important. We need to push for things. Okay, so we have the National Health Insurance Act, okay, where you have less than 10% of the population actually pulled into that. We need to make sure that that's mandatory. We need to make sure that that dovetails and there's actually coordination with all the social health insurance schemes in the states as well, okay? Also, we need to actually do things like really trying to expand the risk pool. So, for example, if this state is doing its own and that state is doing its own, so that's weak. But when you scale properly, you can even buy drugs from big companies in India or do things with them when you can actually achieve scale. There are also the things that what we call sin taxes as well. So, for example, you can tax things like alcohol, like sugar, like tobacco, and actually push them specifically to healthcare. There's what they call the Basic Healthcare Provision Fund, which is supposed to be 1% of the consolidated revenue. One of the key things we need to see is more accountability in how we actually spend money. We want to see things where, for example, the Basic Healthcare Provision Fund going to the primary healthcare actually goes straight to the primary healthcare center instead of going through the local government. They will take their own whatever and stuff like that. So we want more effectiveness and efficiency in terms of how we use our funding.
In all these, do alternative medicine practitioners have a role to play?
Oh, yeah, they do. They definitely do. And we need to actually strengthen that as well. Because one of the key things you need is a situation where things are properly regulated, okay, where at least they can show safety. Okay, if most of the medication you take nowadays, most of the popular medication you take, antibiotics or whatever, they go through a particular They go through processes, okay? And one of the key processes they go through in terms of what they call clinical trials is the safety profile, okay? A drug, a herb or whatever can help for as remedies for some medical conditions and stuff like that, okay? But you need to make sure that it's safe. And so the regulation and the building up and the making sure that you throw in lots of people making sure they're learning the herbal stuff very, very well and stuff like that is extremely important. And yes, you can actually introduce that into our healthcare space as well. But regulation, like I say, is very important. But other things that need to happen as well is to look at the services, Eddie. The services. Services in terms of providing the services. Providing the services for the people. The health services, okay? We need to be bottom heavy, Eddie. Okay, so that means that if you look at about 80% of the medical issues that we have as a people can be sorted out at the basic healthcare level. Okay, but unfortunately, Eddie, our basic healthcare level does not exist. We call it the primary healthcare. Okay, it doesn't exist. So what do we need? We need to make sure that, for example, we have governments that understand, first of all, I've talked about the philosophy, understanding, making sure they understand the importance and stuff like that. The time of 2027 is coming, isn't it? We're going to be seeing many people throwing their hearts into the ring and talking about, we must ask them these questions. What are you going to do about the financing? The financing I've talked about, healthcare. What are you going to do about services? One of the key things you need to do about services is really mainstream primary healthcare. We have about 9,000 wards in the 774 local governments. You can start there and make sure that each ward has a properly staffed, okay, has all the basic requirements, has power, solar really, really good, water, the basic equipment, and all the key staff, the community health extension workers, the pharmacy lab technicians, and also make sure that they have the drugs as well, okay? Because if your mother your grandmother in the village or whatever goes into a primary healthcare center, it's not functional, okay, maybe it's marginally functional, and there's no drug for her to actually get at the end of the day and stuff like that. That's a struggle. We need, in a very poor country like ours, where the World Health Organization is talking about us moving to almost 140 million multidimensional poor people, you need to make sure that you actually push for promotive and preventive care, okay? Your grandmother in the village should actually have promotive healthcare in that primary healthcare center that is looking after her and preventing her high blood pressure from getting to a point where she has a stroke. Guess what? Because it's much cheaper to actually manage the blood pressure, take the drugs, make sure that you're going to that primary healthcare center and you're being looked after properly, than to have the stroke. And then when you now get to the tertiary hospital, you need to spend millions.
Right.
Okay?
Adequate funding or financing, one thing.
Yes. Services.
Have you thought about the human resources aspect?
So
at the time, most professionals are living for what they term
that is a critical. In fact, that was the next one I was actually going to go to. So, for example, we talked about the resident doctors. And just to explain to Nigerians, so resident doctors are junior doctors who are actually doing postgraduate training. They finished medical school, they are doctors already. They are doing postgraduate training to become specialists. Okay, the human body is so complex that you need specialists that deal with different parts of it. So, for example, I'm a brain surgeon. Okay, so I deal with the brain and the spine. I'm a brain and spine surgeon. Okay, so just the way you have cardiothoracic surgeons that deal with the heart and the lungs and stuff like that. Okay, so that's what they are. So the key thing, yes, the brain drain issue and the issue of a significant number of Nigerians, really young Nigerian doctors, nurses, other healthcare radiographers. Because I keep repeating this, healthcare providers are not just doctors. Doctors here seem to be representative of them, but you have other healthcare providers. A significant number of them would love to leave Nigeria if they had the opportunity. And of course, if you look back over the last 5 years, you're going to see significant numbers of these people that have left. And why are they leaving? Of course, welfare and the environment, and the fact that governments, communities, and the whole of us, length and breadth of the country, we have still not prioritized healthcare and given it its main a pride of place in terms of our development focus and stuff like that. So the key thing is how do you reverse that? First of all, you make sure that you mainstream the welfare of these people. Okay.
Right. As you wind down, given your years of experience and exposure, so what are the prospects of a better healthcare system?
The prospects of a better healthcare is dependent on us as a people and our governments, okay? I go back to the people because, for example, we're going to 2027, we're going to the elections, okay? And of course, one of the things that we say is that elections have consequences, isn't it? If you don't look at the issues of pushing accountability and asking the key questions and understanding what is really important in terms of deliverables, in terms of governance, okay, then you're not going to be asking the right questions and pushing for the right things. And I'm saying that if you want a healthcare system in the very near future that can deliver you some level of quality and safety, and one that Nigerians can be proud of, okay, because the issue of healthcare is actually, in terms of your global reputation, is extremely important, okay? If you want that, then first of all, from the community and from the people and from the citizens, you must be demanding, you must first understand the importance and then be demanding it. Then from the other side, the people who actually, as the politicians are supposed to be providing governance for us, they need to understand the importance of healthcare and slowly start understanding that thing that I talked about, that you have to think right, act right, and spend right. I see the spending of governments in our country sometimes, and I just cringe, okay, in terms of where they should actually be putting money. And we need at different levels, either at citizen level or at government level, we need to keep pushing all these things because, like I always say, Eddie, the Nigerian patients are worth it.
Yeah, thank you very much. I must express my admiration for your enthusiasm and the zeal with which you mentioned of your points. Yeah, thank you very much for coming on the program.
Thank you once again, Eddie, for having me.
Yeah. Dr. Douglas Okor, he's a neurosurgeon and also a health sector reforms advocate. The program continues shortly.